certified surgeon for plastic surgery. So first of all, you want to look for someone that actually did full training in plastic surgery. So for most of us, actually all three of the surgeons here at Pure Plastic Surgery, we first did a full general surgery residency, and then we went on to do a 3-year plastic surgery residency or fellowship afterwards. So lots of years of training as surgeons, and then everybody here is board eligible, myself, or board certified by the American Board of Plastic Surgery. I'm board certified by the American Board of Surgery for my general surgery. But those are the things you really want to look for. There's a lot of people calling themselves plastic surgeons or more so cosmetic surgeons in South Florida, and they are not one and the same. The plastic surgeon has gone through all the training to be a fully trained plastic and reconstructive surgeon.
That's right. So plastic surgeon involves a lot more training, many years, like you said. So we did 5 years of general surgery training and then 3 years of plastic surgery. That's 8 years of training after college, medical school, and all that.
Yes.
Okay. And so one of the things, well, how can you check, right? So you can go to the website. So you can go to the American Board of Surgery website for the general surgery boards, which we both have, or you can go to the American Board of Plastic Surgery website, and you can check there if your surgeon is board eligible or board certified as well. So that's one place where you can actually go and check if they have this training and certification. All right. So that's for the surgeon, and that's just kind of like the general kind of background check, okay, which is very important. Of course, you always want to make sure that your surgeon also has a license, right?
Yes,
That'd be good.
absolutely.
Right? So you can check that on the Florida Department of Health website, okay, and make sure that you have a surgeon with an active license. Very important.
Unrestricted.
Yes, unrestricted, active license, all right? So those are a couple of things that you should go and check out before you choose any surgeon out there, okay? All right, what about the facility, right? So it's not just about the surgeon, but it's also about where are they operating, okay? What type of facility is it, and what type of certification does that facility have, okay? So for most aesthetic procedures here in South Florida, we do what's called an office-based surgery facility, okay? That's the type of facility that we have here at Pure, and that's called office-based surgery. There's 3 levels. There's office-based surgery, and there's an ambulatory surgery center, and then there's, of course, the hospital, all right? But when we're talking about aesthetic surgery, we're typically talking about office-based surgery. Now, office-based surgery also has different categories of certification, all right? There is your most baseline level, which is when you're certified by the Florida Department of Health, okay? If you don't have this, if you don't have this one, number 1, then you can't operate. You're doing it illegally, okay? So at the very least, they have to have this. Everyone needs to have that in order to be able to legally do surgery in an office-based surgery setting, okay? And that you can check again on the website, okay? Then there's the next level, a little bit higher levels, what's called Quad ASF, okay? And then you have the most, basically, the most stringent level of certification, the one that has the highest kind of safety protocols and standards, and that's what is called the Joint Commission, or JCO, okay? And that's why you have a little star here. That is what we actually have here at Pure. And this is actually rare for office-based surgery, but we don't just talk the talk, we walk the walk. We actually go the extra mile, and we get certified by the Joint Commission, and we have the certificate there. If any of you want to see it, just ask for it, and we'll send it to you, so you can see that we are JCO certified, and pretty much I can count on one hand how many office-based surgery centers in Florida have JCO certification.
You really have to have your ducks in a row to be able to achieve that level of certification, and that's what Dr. Earle's been able to build here at Pure, and one of the reasons why I joined this practice. So going into that is safety protocols, and that's a lot of what goes into getting those types of certification, especially like JCO, is what kind of safety protocols you have in place for any time something should or could go wrong. You have a set of procedures to do to make sure you're able to nip it in the butt and take care of it right away. So we have that for our operating rooms. We have crash carts, different things available. We know how we practice drills, fire drills, all these different things that you can do to be on top of your safety protocols. The other thing we do here is we track our complications. We take a lot of time to do that, and we actually share that on an annual basis. So I have not had my first year review to share my complication rate yet, but Dr. Earle and Dr. Vidal have been doing that here consistently, and it always comes in below national averages. Complications, things like infections or wound healing issues, that kind of stuff, always comes in below national averages, and it's something we need to track and make sure if they identify a problem, we can address it.
So that's right. So your first one's going to be this December. So we do it every single December. I've been doing it for about 5 years. Dr. Vidal for 3. Dr. Wegerif's going to have his first one now in December. And yeah, we're going to talk about anything from like seromas to, do we have any fat embolism or any death? And of course, fat embolism and death has been 0 every single year, and it will continue to do so. We're one of the first centers, and that's going to go into what Dr. Wegerif's going to talk about now, one of the first places to use ultrasound imaging for BBLs, for example, okay? But another one that's big is infection rate. So for example, again, BBL, national average infection rate is somewhere around 10%. Our infection rate here at Pure is about 1%, okay? Because of all the things that we do to minimize that complication rate as much as possible.
So again, going on with safety is different technologies that we can use, and we've adapted here at our practice to make sure we're delivering the safest care possible. And some of those technologies related directly to the surgery are ultrasound. So ultrasound guidance for every time we do fat grafting procedures to the buttock to make sure we're staying in that right plane above the muscle to decrease that risk of having a fat embolism. All right. Another big thing that we have at our disposal here and we use frequently for our liposuction cases is Cell Saver. This is a device that helps us recycle your blood that came out during your liposuction procedure. We wash it, we concentrate it again, and we can get it back to you to decrease the need for transfusions or anything like that following your surgery. So those are
those are 2 great examples of like technologies that we use to further, decrease any potential complications and further increase the safety profile here at Pure. And it can be anything from huge things like the ultrasound and the Cell Saver to even small things. Like for example, we use UV lights in our ORs right before every single case, okay, to make sure that if there's any potential, bacteria, virus, or anything in there, that we basically kill it all dead before we start the procedure, okay? So from big things like this to little details like that is what makes all the difference, okay? And so the next thing is, of course, hospital privileges. In order to be able to do surgery in an office-based surgery setting, you have to have either 1 or 2 things. You either have to have hospital privileges or the facility has to have a transfer agreement with the hospital, okay? But you should always check, your surgeon should really have the hospital privileges, okay?
And he should have the privileges for the procedures he's performing.
That's right.
If he's a cosmetic surgeon, most hospitals do not give privileges to do the types of plastic surgery procedures that we're doing, and in the end be able to take care of those patients in the hospital. So you should have privileges for the procedures you actually perform.
That's exactly right. And ideally you want to have it at some of the top hospitals in the area, and they should be very, very close to the office-based surgery center. Okay,
Yes.
so for example, we all have privileges at hospitals that are literally definitely within 10 minutes, even with Miami traffic.
Yeah.
But in an ambulance, if you have to do it, it would be like probably 4 minutes from here. So very, very close to the hospitals where we have privileges. And of course, yes, we have privileges, like we said, for every single procedure that's done here at Pure. Okay. And then, but I've always said the post-op care is just as important as surgery itself. And I'm not just only talking about results, so it is definitely for results, but it's also in terms of lowering complications and increasing your safety profile. And that's why we are so big here in terms of communication and providing resources for your post-op care, right? We know, what's the best, hotels to send you in town. We know what is the best post-op care team to take care of you while you're here, our Med Miami team. We have pop recovery systems that helps prepare you before, during, and after surgery. So say, for example, things you may not even think about. Say, for example, nutrition, right? Say you're not nutritionally optimized, you have surgery, then you're not going to heal well. You're going to have open wounds. You're going to have higher complication rates. Decreases your safety profile, right? So we got to think about all of these things and put that whole thing together in order to decrease complication rates as much as possible and make sure that you guys are safe and we get you home to your family. Okay? Yeah, we do a couple extra things here.
So yeah, for the post-op care, we really want to minimize the risk of complications, and one of our feared complications is DVT or blood clots in your legs. So we send patients home with a VenaPro device, which is similar to what you wear in the hospital, that actually squeezes your calf and helps decrease the risk of developing a DVT or a PE. And then if certain patients need it, depending on BMI or different issues, we can also send you home on blood thinners, again, to absolutely reduce that risk as much as possible.
That's right. So, Lovenox, if you're a little bit of higher BMI or it's going to be a bigger case, then that can be added as well. But pretty much every single patient that gets a tummy tuck, whether it's a tummy tuck alone or with a mommy makeover, will get the VenaPro device. And therefore, they're going to be protected, at night while they're sleeping, while they're not being reactive, and importantly, on the flight. It's super important to wear that VenaPro device on the plane as you're traveling home. Okay? And then on top of all of this, because we are so confident in our safety profile and our record, we also provide something that I think we might be one of the only ones here in South Florida, but we provide CosmetiSure for all of our patients. 100% of pure plastic surgery patients get CosmetiSure. And that is, now we're not just talking about safety in terms of you as a person, but we're talking about financial safety as well, right? So if for whatever reason there happens to be a complication, you are that 1%, well, we want you to be covered as well. So if you end up going to the ER, and that CosmetiSure is going to help pay for some of the financial burden that's associated with, of course, going to an ER or having to go to the hospital. So all of our patients will get the CosmetiSure as well.
Which, patients may not realize, but if you get a cosmetic procedure, your primary insurance may not cover some of these complications, and that's why we've adopted this policy for all of our patients to have this CosmetiSure insurance. In the unlikely event you need it, it is there, and you're not going to be hit with a huge bill.
That's right, and like we said, 100% of our patients get that as part of their procedure. Okay? All right, well, I think that was pretty good.
Yeah.
That just about wraps it up, but we are ready for some questions.
Yeah, let's go there. So, do you do surgery on people who have heart palpitations?
Palpitations, a lot of people can have palpitations for different reasons, so as long as you have a cardiac clearance and you have no signs of ischemic heart disease or anything like that, we can do surgery on patients with heart palpitations.
Yeah, I think it's just a trigger that we need further testing, so you will have a cardiologist check on you, but if everything checks out, we're good to go.
Okay, how long can I get lipo 360 and BBL after a C-section?
So our protocol here is to wait at least 6 months. Okay? So 6 months, and then you should be okay to go.
Yes.
How many times can lipo be performed and how far apart of each?
All right, so every surgeon has a slightly different philosophy on this, and it can be performed multiple times, but you have to think each time you're getting liposuction in the same area, there's additional buildup of scar tissue and less fat available to actually be removed. So we can do it 2 to 3 times. I never will do it more than 3 times in one area. I don't know what Dr. Earle's policy is, but even that third time, it's a discussion with the patient because the risk versus reward for that may be starting to get a little too close. But you can definitely go over an area at least once, but you just have to be cognizant of some of the challenges that you may encounter with that.
Yeah, I agree 100%. So of course, having your first lipo is okay. Having your second lipo, pretty much for the most part, is fine. But the third one, that's really going to be on a case-by-case basis. That's something where you really have to evaluate you, look at your questionnaire, look at your history, let's see if you have any complications, see how everything looks, see how much fibrosis there is, scar tissue, etc., before we make a decision on the third one. And that's it. Yeah, 3 strikes and you're out. Typically no more than 3. because it's just a rule of diminishing marginal returns,
Yeah.
right? So each time we go in there, it's more scar tissue and less fat. And once you go into that same area. And depending how far apart, ideally a year. Certainly not before 9 months, but ideally a year at least between each one.
The more time that is between the episodes of doing it, is their scar tissue just really softens up, and it makes it easier to get a more reliable result.
Why no faja the first day?
Good question. And that's because, and it's a question because it's a change here. Because before, the patients would leave in their faja, right? And that's more of a recent change. And so why did we institute that change? Well, because we're always learning, we're always growing, we're always innovating, okay? So what I found is that what I really want to do is make sure that the skin is doing well before you put your faja on. Because if we see a problem early, if we see like a lipo burn or a faja burn, and we catch it really early, then it's typically, we're able to get it to resolve, and it doesn't become a problem, doesn't become a scar, or anything like that, okay? So what happens now is that you go home without your faja. Our team here checks the skin the next day, and if the skin's looking fine, then we give you the go-ahead to get in your faja. But if there's an area that's questionable, we may say, hey, don't put your faja on yet. And we may give you further either creams or medications to help the skin along. And so that's really the primary reason there. The other thing that I was finding is that sometimes when we put the faja in the OR, and then we have to transport you, and you're moving around, and you're getting home, you're getting in the car, out of the car, moving around, all this stuff, the skin underneath the faja sometimes gets all like wrinkled up in the faja there, and nobody notices until the next day when you take it off. And so then when you take off the faja for the first time, you had like this, literally a skin wrinkle underneath there, which then becomes very hard sometimes to smooth out. So for those two very important reasons, we don't put the faja on now as you're coming out of surgery. We're going to check the skin the next day. Everything looks good, then we'll give you that go ahead.
Okay, next one. Do you help people achieve their weight loss BMI to be ready for surgery?
Yes, we do. We actually offer semaglutide, and we can help manage that during this period leading up to surgery to get you to the BMI cutoffs. Because whenever we're able to lower your BMI to healthy levels, it really helps the total result of your surgery and decrease the risk of those complications.
Yeah.
Why is there a drain used when people have to wear a faja?
Why do we use a drain and a faja? I guess they're talking about our lipos and our BBLs, right? So I like the drain. I like the drain for lipo and BBL because it basically, by definition, keeps those little openings open. And so when you have your massages, especially your first massages, we're able to push that fluid down into where the drain is and then out through the drain, right? So you don't want to keep that fluid in you. That's going to lead to seromas or inflammation or other issues. But if you do it without a drain, then you have to leave the little incisions open, and sometimes they close up on their own. And they close up too early, and then that's a problem, right? Then you have to go to a massage therapist that works inside an office like ours here, where supervised by our nurse practitioner and myself, where we may have to open those incisions again, right, so that we can drain them out. So the drain kind of prevents that, and that's really the main reason. Now I know there's some patients out there that are like, absolutely, Dr. Earle, I just don't want to drain, I don't care. If you're like, absolutely, you don't want it for Lipo 360 or BBL, that's fine, then we won't do it. For tummy tuck, for me, I use drains, but again, you have an option there. If you don't want drains and you want your tummy tuck, then you can go to Dr. Wegerif here and he'll do a drainless tummy tuck for you.
Yes.
And you don't have to worry about those pesky drains, okay? So, like I said, if you are absolutely against drains, you have options here.
Absolutely.
Can I do a tummy tuck and a BBL together? If not, which one first?
So technically some people do it. We both feel that it's not a good idea to do together because they're two competing procedures. Your tummy tuck, we're going to tighten everything up. You need to lay on your back to recover. A BBL, we freshly grafted fat to your butt. You have to stay off of your butt. So I don't really see how you can successfully do both of those things and get the best results from either one of those procedures by doing them at the same time. So neither of us offered them at the same time. And what was the second part of that question?
How far apart?
Oh, how?
No,
which
which
one should
first?
we do first?
Oh.
Yeah,
Okay.
which one first?
So that's something that's evolved for me. I used to kind of do the BBL first and then the tummy tuck, but I've run into some issues on some patients that had really bad scar tissue going back to do the tummy tuck afterwards. So now I recommend getting the tummy tuck first, getting all that loose skin taken care of, and then coming back later to do the lipo BBL, and we can be really aggressive with the liposuction and get you the result you want.
Yeah, I agree 100%. I always say tummy tuck first. I think that's the way to do it. Get rid of the loose skin, fix the weakness of the muscles, do the muscle repair, bring them together again. And now you've gone from having basically poor quality skin, right, which makes lipo a lot more challenging and makes it much more likely that you're going to have unevenness when you have poor quality skin. So now you've gone from that kind of baseline to where you have high quality skin because all the poor quality skin has been removed and the skin's made tight. So now you have the chance of having a beautiful liposuction, completely even, and you even have the chance of doing HD lipo if you want to, right? So with poor quality skin, you're not a candidate for HD liposuction. But now if you have a tummy tuck, you become once again a candidate for HD liposuction.
Okay, this is a message for you, Dr. Earle. Hi, Dr. Earle. I had surgery with you in November.
All right.
And couldn't be happier.
Yeah, all right, awesome. Please, come back. No, write to us, let us know, and send us the follow-up photos so that we can see how great you're doing.
Great. How many massages weekly should people get after lipo?
So for that kind of is an evolving process, but for the first week after lipo, it should ideally almost every day you can get a massage. The more massages, the better. It's going to help get all that edema and swelling out. It's going to help everything contract down. When you're entering your second and third week or on, you can start pushing it back to every second or every third day. But again, kind of my philosophy is the more massages, the better with the lipo.
That's right.
Okay. Value your opinion very much. How long do you recommend for faja use?
So the faja is something that we highly recommend for either a lipo360 BBL procedures and even for tummy tucks as well. But for the lipo360 BBL, we recommend the faja to be used pretty much night and day for the first 6 weeks, and then you're going to scale down to 12 hours a day for an additional 6 weeks up until you get into the 3-month mark, okay? So first 6 weeks, night and day, and then an additional 6 weeks, 12 hours a day.
Okay. Will I be under general anesthesia for a BBL?
Yes, at Pure Plastic Surgery, you will be under general anesthesia for a BBL. There are some places that do this under local, and it's just really, really hard to do those cases properly under local. It's too uncomfortable for the patients and the surgeon, and it really do a much better job when you're under general anesthesia.
Yeah, and also, at least in my opinion, in terms of safety, so when you do a large liposuction procedure, right, and you're going to do it under local, well, the only way to do that is by adding a medication called lidocaine, right, which is the numbing medication. And what you have to be careful with is that if you use too much lidocaine, then you can have something called lidocaine toxicity, which can affect your nervous system and your cardiac system, okay? And that can be very, very dangerous as well. So then you get run into a problem. Say you're doing that procedure, the patient's still moving around, they can still feel it, but you really shouldn't do more lidocaine, because if you do, then there's going to be a problem, and so then you're going to be limited as to how much lipo you can do, and you're not going to do a good job. So that for all of those reasons, we don't do it that way here. When you do general anesthesia, we use 0 lidocaine. So the chance of lidocaine toxicity, is 0.
Okay. 2 more questions. Okay.
All right, let's do it. Dos más.
Dos más. Ok. Voy con la de español entonces. Ya.
Oh, all right.
Preguntan si hay financiamiento, about financial options.
Yes, sí hay financiamiento, tenemos varias opciones. Tenemos opciones, una que se llama Care Credit, otra se llama Alphion, otra se llama Cherry. Okay, so tenemos varias opciones de financiamiento. y todo depende de tu crédito, cuánto depósito, etcétera, etcétera. Pero hay varios planes que pueden usar y en general aceptamos a básicamente cualquier persona con esos planes.
Okay, so it's required to get a tummy tuck if you have excess skin from pregnancy, or can you still get a lipo 360?
It is possible. You can still get a lipo 360, and this is what comes down to the consultation and what your expectations are. Some people just want to look better underneath, even wearing a garment like Spanx or something like that. That's your expectation, and you understand that you're going to have loose skin. We can still do a liposuction, but most patients, they're going to then want to come back and get that tummy tuck.
That's right. All right, that's it. All right,
everybody. Thank you very much.
Okay. All right, everybody. Well, I hope you kind of took a screenshot of that. A lot of things to check. Remember, we told you about several websites to check, right? You can check the website from the American Board of Surgery, the website from the American Board of Plastic Surgery. Of course, you can check all the websites from the Florida Department of Health. All right, and that's going to give you a lot of information about the surgeons and the facilities, okay, and the Joint Commission as well. All right. Well, we look forward to seeing everyone next week. You will see me on Hump Day with Dr. Earle on Wednesday and
Dr. Wegerif on Thursday Thoughts.
that's right. Take care.
All right, everyone.
Ciao.
See ya.
Okay.
All right.